This is a suckler cow at pasture which cannot get up. At first, everything seems quite normal. But this is the second time in 2 weeks that this cow has not been able to rise. She is anemic, and the whole group appears underweight. And a fever is unusual in such cases. All this made me think that it was a bizarre case beneath its banal appearance. And as anemia is on the list of key symptoms, an alert has rung. So it has to be checked out on Vetaid and see what can be hidden behind a strange situation. Therefore, select Diagnosis with Comprehensive Examination, then specify that the patient is a suckler cow in full lactation. Indicate that the call sign is a downer cow, unable to rise. Then, that the problem has been going on for at least 2 weeks, as it had been noted that she had been unable to rise at that date. Next, point out that she is depressed and lethargic. There is therefore a recurrent problem. Then, enter that it is during summertime and in pasture. There is nothing to report on the following screens until the point where you state out that the problem is a collective one and that there is a fever. For the rest of the clinical examination, few things to report initially except intermittent diarrhea, which hardly worried the breeder. It is important to note that the vaginal mucosa is very pale, as is the conjunctival mucosa, which you note further down in your questionnaire. Multiple answers are normal with the following questions, but when arriving at locomotion posture question, you must report that the cow cannot get up, and a little further that it is depressed but not sleepy, and that her reactions to stimuli are diminished. Finish quickly, as you have not done a urine dipstick test yet. The result screen appears. It shows in number 1 a suspected SURA, type trypanosomiasis, accompanied by a red alert. And it shows a good concordance score. Work on the suspicion here. See what matches between your patient's SURA in its typical form there are, and what doesn't match. Checking whether there are inconsistencies. You see that Vetaid reports a major inconsistency, but this inconsistency does not call into question the SURA suspicion. This suspicion remains well-founded. If you think that you have forgotten a symptom or made an error, you can always go back to an entry or click above on this icon to review and, if necessary, correct an oversight or error. And if all goes well, you must therefore report this case to the designated authorities in your region and to the GTV coordinator. First, save your report here, complete it, then send it in full by email in one click. Your epidemiological surveillance work is done. You can always find this saved diagnosis on the homepage My Diagnostics. By opening the memo sheet, you will find information on SURA, but above all, it will tell you what samples to take before leaving the farm to confirm the suspicion. Once the report and the samples have been taken, you can continue your diagnosis and try to explore other suspicions, of course. Or go to track 3, find out about diseases combining symptoms of both diarrhea and anemia, and there are many which do. You alone are the diagnostician, with the full abilities, due to your use of the Vetaid tool that you are well on your way to mastering.